Hello from KFF Health News and WAMU Public Radio in Washington, D.C. Welcome to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News. And as always, I'm joined by some of the best and smartest health reporters covering Washington. We're taping this week on Thursday, August 13th at 10:30 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined by a video conference by Edney of Bloomberg News.
Hi, everybody.
Maya Goldman of Axios News.
Great to be here.
And Sandhya Raman of Bloomberg Law.
Hello, everyone.
Later in this episode, we'll have my Bill of the Month interview with Paula Andalo. But first, this week's news. We'll start this week with vaccine policy, more specifically, vaccine policy being made from the Oval Office. On Monday, President Trump, surrounded by HHS Secretary Robert F. Kennedy Jr. and other health officials, signed an executive order calling for, quote, gold standard childhood vaccine recommendations. The order calls for the current federal childhood vaccine schedule to be divided into three parts, one with a shorter list of shots recommended for all children, another list for high-risk populations, and a final list of vaccines to be given as a result of, quote, shared decision-making between doctors and parents. The president also wants to separate the combination measles, mumps, and rubella vaccine into three separate shots, which don't actually exist in the U.S. at the moment. That would necessitate more visits for parents and more individual sticks for kids. While the order itself has no force of law, it does direct each executive department and agency to, quote, take appropriate steps to advance them to the full extent allowable by law. So what's the immediate impact of this, besides a whole lot of confusion? Because when RFK Jr. tried to do essentially this back last year, it was blocked by a federal judge.
Yeah, I think confusion is the main impact of this right now. This kind of comes in the news every so often because President Trump has not wanted to let this go, even though we kind of thought he was, or at least RFK Jr. was directed to let it go because of the midterms and how that was looking. But this is something that President Trump has really had on his agenda and not let go. And I think that there is not really a possibility for an immediate impact, say, with breaking up the shots. Like it doesn't, like you said, it doesn't exist here. Merck, which is a company that makes these MMR shots, said that could take up to 10 years. It's not just a simple thing for them to do. So in the meantime, you have some parents who are wondering, well, is this bad? Like, what should I be doing? So I think confusion is the number one impact here.
Yeah, I want to break this down into sort of what it means for health and what it means for policy and what it means for politics. So in terms of health, the U.S. is already in the midst of its worst measles outbreak since 1991, and we're seeing more cases of other vaccine-preventable diseases, including whooping cough and even tetanus. And pediatricians are already slammed. How are they ever going to make room for all these extra appointments and parent discussions of these vaccines that used to be sort of generally recommended and now are going to have to be the subject of individual discussions? Anna, you're the mom on the panel.
Yeah, I was thinking that from the parent side, but yes, from the pediatrician side as well. I mean, they're already overwhelmed. They already have a huge list of patients trying to get in for many things. And from the parent side and the child side, this is, like you had mentioned, more sticks. There are the children will have to be given more shots in this case. And a lot of times that can mean missed shots because, going once kind of gets everything done. We all like to have a one-stop shop versus having to go to a bunch of different times. And so besides the confusion could decrease vaccine adherence because people just might miss those shots. They're going into the first year of childhood. So many parents, even in the first couple weeks or months, are back at work and they're having to carve out time for this. So it could really overwhelm the pediatricians' offices with these conversations and, kind of just lead to actually less protection for children.
And hence I'd say the increase in vaccine preventable diseases that we're actually seeing. Go ahead, Maya.
I was just going to say there are also all these other logistical concerns. Like we mentioned, these shots don't even exist yet in the U.S. So that's, step one. But then you need more storage at the pediatrician's office for a shot that's 3 separate shots instead of one combination. You need more people working at the office to accommodate all the extra appointments. They're already in a shortage of pediatricians in a lot of places in the country and healthcare support workers. And so it's just this huge cascade of side effects.
Yeah, and I
Well,
think we should add too that when President Trump talked about this from the Oval Office, he linked wanting to separate these shots to the rise in autism. And there is evidence that's showing that that is an issue and that the shots should be separated for that reason.
and just last week, we had another large-scale study that showed no increase in autism due to in childhood vaccines. I want to talk about policy, too. There's one particularly ominous phrase in the EO that says that states who set the rules on which vaccines are required for school attendance are, quote, advised to review the recommendations and, quote, consider updating relevant laws and regulations that define the scope of immunization requirements. On brief call with reporters on Monday, one administration official suggested that newly sworn-in Attorney General Todd Blanche could go after states that don't provide enough exceptions to their immunization policies with violating federal religious freedom laws. Is this really good policy or good politics? I mean, most states, I did go back and look, most states have exceptions, have medical exceptions. Obviously, kid can't take the shot. Most of them also have religious exceptions, but it's not clear how broad this administration wants those exceptions to be and what it might do about states that don't allow exceptions. I would note that one of the few states that has almost no exceptions is West Virginia, which is a very red state.
I think this is really the area that to watch on this. I mean, a lot of the other pieces of this executive order are broader and I think a little bit more, messaging to the political base based on some of these logistical issues that we've kind of outlined. But this is a direct action to 3 different agencies, to look at these exemptions. And this is already something that they've been kind of investigating, having there are already some lawsuits about some of these exceptions in the 5 states that don't have as the same exemptions as other states. So I think here is really the area to look, especially with Blanche now confirmed, and just keeping an eye on some of the existing cases that are already there, kind of challenging some of these exceptions, because this is really where we could see movement, or just even on the state level for them passing additional laws. That was something mentioned in the presser too, that they were going to encourage states to do this. So I think state level is somewhere to really look, especially, vaccine requirements come down to schools, and those are on a state by state level done by education, not HHS. So that's where I would be watching.
Yeah, there's more to come, I suspect, here. Before we leave this, though, I want to talk a little bit about the politics. I mean, Anna, you mentioned this. There were polls that showed that going after vaccines was not very popular with Democrats or Republicans, and that Secretary Kennedy was told earlier this year to focus on other things instead. Why is Trump bringing this up 2 months before the midterms? I mean, what politics is this aimed at? I guess that's my question, because I certainly don't know.
From the reporting that I've read, and the Wall Street Journal did a great job on this, and Politico, this is just something that Trump himself believes and does not want to let go. He's talked to the HHS secretary about it time and time again, saying, basically kind of needling him to get on it, even though others have told him not to do that. And so it seems like something that the president really wanted to happen. And just given this discussion we just had, I think it's pretty evident that most of it is kind of we let him do his thing. He got to talk about it in the Oval Office, and hopefully he'll shut up about it now and nothing will actually happen. I think that is a possibility.
We'll see if nothing actually happens. But one more thing before we leave the vaccine wars topic, a story from last week that caught my eye. Texas Attorney General Ken Paxton, who is also Texas Republican Senate candidate Ken Paxton, announced in his AG role that he has opened an investigation into the American Academy of Pediatrics. That's the group that's led the charge to preserve the immunization schedule according to, science. Paxton, in a press release, says his office is looking into, quote, concerns that the organization may be promoting and recommending childhood vaccines for financial gain. Now, given that most pediatricians lose money on giving vaccines, that feels like a bit of a stretch, or am I missing something here?
Yeah, I think what I interpreted from that announcement was, he's concerned about the organization of AAP, which has some big funders in the pharmaceutical companies. So maybe he's claiming that the organization is worried they're going to lose that funding, as opposed to individual pediatricians making money off vaccines. But I think it's really from AAP's perspective, you damned if you do, damned if you don't, right? This is something that they have done the science on, looked into, and that's what their basis is. It'd be very interesting to see if this actually goes to court and if there's, a legal argument to be made here. I think this is like something that is just starting to unfold.
What struck me was, it's similar to what we've seen in sort of other areas as well. It's the same kind of rationale we've had going after some of the transgender medical professional groups, saying that, they've made various recommendations about gender affirming care for financial gain and, questioning some of those decisions. So in that way, it's not unique, especially since Texas has kind of led the charge on some of those. But I do think it's interesting that we're going after some of the same organizations for this again and again.
Yeah, I'm wondering sort of the political benefit for Paxton of going after the American Academy of Pediatrics, but we shall see. All right. Speaking of politics, the Centers for Disease Control and Prevention got a new director this week, at least according to its website. I have not seen that she's actually been sworn in. A year after its old director was ousted for refusing to rubber stamp Secretary Kennedy's hand-picked vaccine advisor's recommendations, Erica Schwartz, a former deputy surgeon general, told the Senate Help Committee during her confirmation hearings that she supports the vaccine schedule and would, quote, never betray the science. She's about to get tested on that, isn't she?
I think it was a really interesting choice. They didn't swear her in before they held that event and bring her out there. We did have Bhattacharya as the acting official, but they could have easily brought her in there to speak on that, and they didn't. I think that was a conscious decision.
I was just going to say they waited until she got confirmed.
I would say she got confirmed last week, and the event was on Monday, so they could have sworn her in time for the event.
Right. They did the event after they confirmed her, but before they swore her in.
Right.
To shore up support in the Senate.
Fair point. Yes, rather than rub it in Cassidy's face right before he voted to confirm her. That is an excellent point in terms of the timing. Well, meanwhile, things at the CDC are still apparently not great. It's been almost exactly a year, not just since the last director was ousted, but since a gunman literally shot up the building, killing a security officer because the gunman's father said he believed that the COVID vaccine had made him suicidal. Secretary Kennedy went to visit the CDC campus in Atlanta for a memorial for the officer last week and held a fireside chat with CDC staff who were, shall we say, not very impressed with his fireside manner. Among other things, according to a transcript of the meeting, he repeated that scientists are not trustworthy. All this comes at a time when CDC is fighting an Ebola outbreak in Africa, several foodborne outbreaks here in the U.S., and the aforementioned spike in vaccine-preventable diseases. It's not a great time for the CDC, is it?
It's really not. And there's a great op-ed in MedPage this week by an anonymous CDC staffer that sort of outlines all of the different things that, I've even forgotten the CDC has gone through in the last year, thinking about Ebola and funding cuts. And just this person said that they can still see damage from the bullet holes when they're sitting in their office. It hasn't been fixed. And you really have to feel for these workers that are trying to do their best, but not being given the resources or support to do it.
Yeah. And I will say, after decades of covering the CDC, the people who work for CDC are, among the most mission-driven people in healthcare. I mean, they toil in sort of the, most difficult parts of the healthcare system and are like constantly fighting uphill battles and not getting a lot of support, I would suggest, from the current administration. Well, meanwhile, the never-ending Medicaid news keeps on coming. This week, the Trump administration issued final rules banning certain gender-affirming care for minors. Now, this is separate from its rules for hospitals, right, Sandhya? You wrote about this, yes?
Yeah. So the rule this time is related to Medicaid for under 18. And for states that also fund the CHIP program under 19, they would also have to comply with this rule. And kind of what struck me was that we, just on this podcast, I think, maybe a month or so ago, there was this, is the administration going to pull this back or not? And there had been reporting saying that they were, and then HHS said, yes, we are still going ahead with this rule. So indeed they did. I think this is part of the broader framework, like you said, of different things related to them wanting to, emphasize, biological sex in their various rulemaking.
Yeah. I think an important distinction about this particular policy is that it strips federal funding, federal Medicaid funding from states to cover gender affirming care for minors. So states can still use their own state dollars if they choose to. Private insurance can still cover this, no problem. This is not a ban on gender affirming care, but it will certainly make things more difficult for children on Medicaid who need this care, want this care. And especially as states are facing so many other cost pressures, it's going to be hard to come up with money to patch this hole if they want to do that.
And to be clear, we're not talking about surgery here. I mean, we're talking about all kinds of care, including counseling, right?
Counseling actually is not included in this one.
Okay.
They can still use federal Medicaid funding to cover counseling.
But not other forms of
Yes,
non-surgical
hormone
gender-affirming care.
therapy, puberty blockers, exactly, which are recommended for kids with gender dysphoria by most major medical associations.
Including the aforementioned American Academy of Pediatrics. All right, next in the Medicaid realm, those work requirements that begin next January. We've talked at some length about how the federal government is going to give people an extra year to self-attest that they are too sick to work before they have to get proof from a medical professional. But a story from Politico this week points out that some states aren't taking that option. 8 Republican-dominated states, including Arkansas, Idaho, Ohio, and Indiana, are declining that grace period and making their work rules even stricter than the administration is otherwise requiring. What's the likely impact of this? That in January, they're going to have to start proving immediately that they're either too sick to work or they could lose their Medicaid.
Well, I think usually, at least the point of doing a rollout, I guess, is, giving states time to figure it all out and giving people time to understand what they need to do. So those states are choosing not to do that. So it kind of seems like this could create a lot more chaos than even was anticipated in the first place, and maybe potentially a lot more people coming off the rolls than when maybe they shouldn't have been, just because of paperwork errors or misunderstandings and things like that.
And much like pediatricians who were worried about having to break up vaccine appointments into multiple appointments, doctors are kind of freaked out about having to see all these patients so they can, write them notes to excuse them from the work requirements, which is another burden that I don't know that Congress sort of really fully accepted when it was deciding, and the administration was deciding how to implement these work rules.
That's not something they normally do, assess whether someone can go back to work. So I'm sure they would probably prefer not to be doing that. But if they, without sort of the time and the ability to figure this out, it could be even tougher. And people will be trying to rush to get in there to get this done.
Well, I guess we'll be watching these as, quote, the early states when this all begins. All right, we're going to take a quick break. We'll be right back. So the vaccine executive order from the president very much overshadowed what I think HHS Secretary Kennedy had hoped would be the big HHS story this week, the unveiling of proposed new standards for food additives that have been deemed generally recognized as safe, or GRAS. The rules, which have been a long time coming, as in several administrations long, wouldn't so much make it harder for companies to use food additives like thickeners and stabilizers that are often seen in highly processed foods, but it would require companies to tell the FDA how it's using those substances. And it stops well short of what former Republican FDA Commissioner David Kessler had been urging in a citizen petition that he filed more than a year ago. That would have made companies actually prove that those products are safe before they can put them in the food supply. Why are these rules so timid? Isn't, making the food supply safer Kennedy's one of his biggest maha goals?
It seemed to me that the way the FDA put it was that they needed Congress basically to step in to boost their ability maybe to do more. Sometimes that's an excuse not to do more. Sometimes it really is true that they could really open themselves up to challenges from big food and court challenges that they don't want to fight. And so they do the thing that they think they're able to, and then tell Congress, we need you to go the rest of the way.
Interesting, because they don't seem to be afraid of court challenges or, stepping on Congress's toes on lots of other things. I mean, is this really just emblematic of the power of big food? I mean, we've already seen, Kennedy be sort of squashed by the power of big pesticide.
Yeah, I think that that's absolutely the case, that big food, they put their lobbying to work, and they talked about how this could stop them from being able to innovate and being able to get newer things into our food, and that basically we should trust them. What they're putting in there is safe, and so that has had some sway. Particularly, there have been a lot of industries that have been able to go to the White House and make those cases, and kind of water down things that RFK, or like you said, former FDA Commissioner McCary, had said they were going to do.
I've also seen some statements from quote unquote big food lobbying groups arguing that this is an affordability issue. If they have to comply with all these extra rules and regulations and pre-market reviews, that could tank the president's affordability agenda is something that I saw.
I would say we're all still waiting for the new definition of highly processed food. So we will see what that ends up. On another subject regulated by HHS, Secretary Kennedy also announced major action to start the process of decertifying the organ procurement organization that coordinates organ transplants for the region that includes Kentucky and parts of Indiana, Ohio, and West Virginia. OPOs are the go-betweens between medical professionals who care for patients who become organ donors and those who care for the transplant recipients. There's been a lot of attention to some pretty big failings in the organ transplant network over the past couple of years. This case cites instances where potential donors were not yet dead. That's a big problem. But you have to wonder if the public is going to wonder whether dramatic action like this is warranted because the OPO really is deficient, or whether it's political, since we've seen this administration going after some states and some organizations for, what they say is fraud that looks like it might more be about, electoral politics.
I think this is a little different with this organization, Network for Hope. We've had a lot of action over the past year or so on this organization in general. We had congressional hearings about it. We had letters from lawmakers with concerns about this. And it's not the first time that they've moved to decertify. There was a division of University of Miami Health System that they decertified last year. Again, documented problems about this. And even if you listen to some of the statements from Democratic lawmakers, they are not against this. I think that, it's a recognized problem across political lines, which is a little different than some of the issues where fraud is being, viewed more through one lens than another.
There is a point at which HHS is supposed to regulate organizations. I mean, they're supposed, when they find evidence of an organization not doing what it's supposed to, they're supposed to take action. That's kind of how the government works. Sorry.
The New York Times has done a lot of great reporting on the organ procurement system and kind of showing many, many flaws. But I think for this one, specifically when I read about what made HHS look into it, it is shocking and a little scary. So I do understand, what happened was there was a man who overdosed, and he wasn't quite dead, but they were starting the procurement process, and he was waking up, and it just seemed like they kept going on this a little too far. He survived. They didn't get any organs out of him. But if you sign that form that says you're an organ donor, it's not something you want to think about if something happens to you and you're not quite dead, that they might decide to go ahead. And then HHS did find that this had happened on many occasions. So I think that it seems like something that the government should have stepped in on.
Yeah, there were some pretty serious deficiencies here. All right, well, that is this week's news, or at least as much as we could get to. Now we'll play my Bill of the Month interview with Paula Andalo, and then we will come back and do our extra credits. I am pleased to welcome back to the podcast my colleague, Paula Andalo, who reported and wrote the latest KFF Health News Bill of the Month. Hi, Paula.
Hi, how are you?
So this month's patient is kind of a success story, right? Someone with a non-emergency condition and no health insurance who was nonetheless able to shop around for the best price. Tell us who he is, where he lives, and what kind of care he needed.
Yeah, his name is Rommel Rangel, and he's from Venezuela. He moved to the U.S. in 2019 to live with one of her daughters that live in Portland, Maine. And he has been living there since.
And then he got sick and needed.
So it was interesting because 25 years ago, he had an inguinal hernia and he had surgery in Venezuela. And at the end of last year, he began to feel a pain on the other side of the body. Again, it was a hernia, so he needed surgery.
So he'd been through this before.
Yeah, in a different health system. So he doesn't have insurance, although he's a green card holder, so he can have insurance. But when he moved here, now he's 64, so it was 6-7 years ago, and he was looking around, the Obamacare and all the stuff, but he realized that for his age, the prices were crazy. He's a pretty healthy person, so he decided to not have insurance. Instead, he began to see a doctor in a concierge medicine, these kind of practices that charge as little as $70 per month to unlimited visits and some small procedures like stitches or
but not hernia repair.
Not hernia. So at that moment, he needed surgery.
Right. So he did the medical tourism thing, looking both here in the U.S. and in some other countries where he had family that he could stay with. And a bit surprisingly to me, at least, he found the best price here in the U.S.
Yeah, it was like a miracle. Yeah, he looked in Oklahoma, but it was far away. Also, he has a daughter living in Sandhya in Chile, and he looked there and it was very expensive, adding also the cost of traveling to Chile. So he finally found his place in Maryland, in Rockville, Maryland, in a place called Affordable Surgery Center. He had his procedure in April.
And how much did he end up paying, I guess, both for the travel and for the hernia repair?
Well, the first estimate that he had was in his state, in a big health system. And at that moment, the estimate was $23,000 for a laparoscopy procedure. In this center in Maryland, the total cost, including anesthesia, was $2,900.
Wow.
So adding the cost of tickets for him and his wife and one night of hotel, etc., it was less than $5,000.
Wow. So that's a whole lot less even than he could have gotten at home in Maine.
Yeah, exactly.
So what's the takeaway here, other than that medical tourism doesn't have to mean a trip to another country to find the most cost-effective care?
Well, the takeaway is that you can shop around, especially if you have an elective procedure, so you have time, because if you have an emergency, you don't have time. But with this kind of procedures that are pretty common and there are different options to do it, you can shop around and look for the best place. He had the help of his family doctor that was very helpful, helping him with lists and place it. But he has had time to shop around, to look for prices and to take care of his hernia.
And I guess it's important to remember that the most expensive isn't always the best, but the cheapest also isn't always the best.
Yeah, exactly. So one advice is, the expert says that you need to look at the reviews of the place and do your homework to realize that if it's a good place. Although the research says that sometimes higher prices doesn't mean better care. But in these kind of procedures, you can pay much less if you shop around.
Well, nice to have a happy ending for a change. Paula Andalo, thank you so much.
Thank you.
Okay, we're back. Now it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will post the links in our show notes on your phone or other mobile device. Maya, why don't you go first this week?
Sure. My extra credit this week is an article titled "To Improve Student Mental Health, University of Michigan Eases Grading." This one is in the New York Times by Mark Arsenault. I am a University of Michigan alum, just like Julie, and so this one caught my eye. But it's also very interesting to hear what universities are taking student mental health seriously to the point where they're making big policy changes, or at least in this case, piloting policy changes to try to get at the root of the problem. I have my own skepticism that this is, the root of the problem. Academic pressures are certainly a big stressor for students adjusting to college, and so maybe this could help, but I think that this is a multifaceted problem, and I'm interested to see how they're going to measure the success of this. But this isn't the first university to have done it. There are a couple others, MIT, Brown. University of Michigan is a massive school with a lot more students, though, so I think it'll be interesting to see if other schools of that ilk follow suit.
I would just point out that I went to the University of Michigan in the 1970s, and even then we could take classes pass-fail if we wanted to. It's not really all that new. But yes, I've seen a lot of rolled eyes this week about this story. Anna, why don't you go next?
Mine is from CBS News by Julia Ingram. Farm linked to cyclosporiasis outbreak hadn't been inspected in 7 years as FDA lags on foreign inspection targets. I thought it was a smart thing to look at that this farm had not been inspected since 2019. And not just that, but that the FDA's been really lagging on all of their foreign food safety inspections, not even meeting 10% of the goal that Congress had set for them about a decade ago. And I thought that was just a great way to kind of get into this story and talk about inspections and how the FDA is struggling. They've struggled for a while to meet these kind of mandates, but showing how it's now gotten even worse since there have been lots of cuts within the agency.
Yep, that we've been talking about, and these are the result of those cuts. Sandhya.
My pick this week comes from Notice, and it's from Margaret Manto, and it's called An Antidote to the Anti-Vaccine Movement Lives in Rural West Virginia. I am from West Virginia, so was a reason why I was really intrigued by reading this story, but it's really good. It looks at the work of a pediatrician in the small town of Somersville. And West Virginia has some of the highest childhood vaccine rates in the U.S. And the county where Somersville is has, some really high rates compared to some of the more populous counties that are around it. This is a county that voted 3 times for President Trump, and just looking a lot at the changing climate regarding, vaccination and attitudes there and, rural health more broadly. So
It's a really good story. Well, my extra credit this week is from the journal Health Affairs by my soon-to-be boss here at KFF, Molly Ann Brody. It's a lovely tribute to one of her and my health policy heroes, Bob Blendon, the Harvard health policy professor who passed away earlier this summer. Molly was lucky enough to have studied under Bob, which I never got to do, but I still feel like one of his students, as he was always so generous with his time and so very quotable, and contributed so much to my personal understanding of the intersection of health policy and politics, which I try to share with all of you every week. We miss Bob already. May his memory be a blessing, and may he live on in those that he taught. All right, that is this week's show. Thanks to our editor, Emery Hudeman, and our producer, engineer, Francis Yang. We also had production help this week from Taylor Cook. A reminder, What the Health is now available on WAMU platforms, the NPR app, and wherever you get your podcasts, as well as, of course, kffhealthnews.org. Also, as always, you can email us your comments or questions or at whatthehealth, all one word, at kff.org, or you can still find me on X at J. Rovner or on Blue Sky at Julie Rovner. Where are you guys hanging these days, Maya?
I am mostly hanging out on LinkedIn under my name.
Anna?
X Blue Sky, LinkedIn at Anna Edney.
Sandhya?
I'm on X and on Blue Sky at Sandhya Rates.
We'll be back in your feed next week. Until then, be healthy.